like to now call up my very good friend Barbara Samuels, who will read Catholics for Freedom of Religion mission statement.
Thank you. Catholics for Freedom of Religion, which has begun here on Long Island, is spreading across the country. The National Catholic Register just did an article on the work that the organizers are doing here on Long Island on Catholics for Freedom of Religion. So our mission statement is simple. We educate and advocate on a nonpartisan basis for First Amendment freedom of religion for all Americans of all faiths. We want to educate, and our churches are a wonderful place to do it. Our churches of all denominations. Our mission statement is to educate all Americans on our First Amendment freedom, how dearly it was purchased for us, how rare and precious it is in this world, and how quickly we are losing it. So please pray for the organizers who are working for Catholics for Freedom of Religion to bring this message to the Catholic churches and to other churches throughout the country. Thank you.
Thank you, Barbara. Now I would like to introduce Dr. Betsy McCaughey, our keynote speaker, and I'd like to just tell you a little bit about her before we begin. Dr. McCaughey is a constitutional scholar with a Ph.D. from Columbia University. She's a patient advocate and a health policy expert and a former lieutenant governor of New York State. Dr. McCaughey is the author of over 300 scholarly popular articles and 3 books on Obamacare, which are on sale at the back table and also the front table if anybody would like to purchase them. And then if Dr. McCaughey has time, she will sign them for you. She has dissected each major health bill and reported the contents to the nation, dispelling false claims such as you can keep your health plan if you like it, or there will be no cuts to hurt the seniors. We are so pleased to welcome Dr. Betsy McCaughey to our center. Ladies and gentlemen, Dr.
and Barbara Samuels, who's tirelessly working for freedom for all of us, freedom for Catholics, but freedom for people of all faiths, because we all so value our freedom of thought and our freedom of worship and our freedom to care for our families in the way we think is best. So I'm very honored to be here tonight, and I'd like to pay tribute to you, because freedom isn't free. It depends on you and me, and that's why we're here tonight. I'm going to begin by simply describing what is in the 2,572 pages of the Obama Health Law, and then walk you through the steps that you might want to take over the next 18 months to protect yourself from the worst effects of this law, and then thirdly describe how we can get rid of this law. Because we can. The Obama Health Law lowers your standard of care. It puts government in charge of your care. And it takes away something as precious as life itself, your liberty. The law requires you to enroll in a one-size-fits-all government-designed health plan, whether you like it or not. When you go to file your taxes, you actually have to attach proof that you are enrolled in the qualified plan, the government-designed essential benefit package. Now, providing that proof, including the name of your insurance carrier and your policy number to the IRS, that will shield you from the penalties, which I can describe in detail. It will shield you from the penalties, but it will expose you to the government's control. Because once you enroll in that plan, for for the first time in history, the federal government will have control over your doctor's decisions, even if you're in a private plan like Cigna or Aetna that you paid for yourself. Section 1311 of this law says that insurance companies can pay only those doctors and other providers who do whatever the Secretary of Health and Human Services requires in the name of quality. Well, that can cover everything in medicine. When a cardiologist chooses to use a stent versus bypass, when an OBGYN does a cesarean or a sonogram. Your medical history and medical treatments will have to be entered into this electronic database. The goal is one nationwide database where every patient has a page. Your doctor's decisions are going to be monitored for compliance with those guidelines, those federal guidelines. And ultimately, your doctor may have to choose between doing what's right for you and avoiding a government penalty. You know, I'm old enough to remember for how many decades now women's rights groups have gone to the barricades to prevent the federal government from seeing what's in their medical records or dictating to their doctors. But it was always in the context of one kind of choice, protecting only one kind of choice, abortion. But how is it that a woman has the right to choose an abortion but not a hip replacement? How can that be? You have to have the right to choose whatever medical care you need. The president said many times that he was going to solve the problem of the uninsured by making health insurance more affordable. I'm sure you remember that. You know that hasn't happened. Almost everyone has gotten premium increases in the mail, and they're going to go up much more. California just announced that insurance plans will be 51% higher in price there in the individual market. The Ohio Insurance Department just announced that plans in that state will be 88% higher. New York hasn't made their announcement yet. In fact, the president didn't solve the problem of the uninsured by making health plans more affordable. What the Affordable Care Act does is to vastly expand Medicaid. That is the primary way of covering the uninsured. Now, that's a very worthy goal, covering the uninsured. But how is this vast expansion of Medicaid paid for? By eviscerating Medicare. It's like robbing grandma to spread the wealth. To pay for this vast expansion of Medicaid, plus the subsidies on the health insurance exchanges, we'll talk about those in a moment. To pay for those, this law takes $717 billion out of Medicare over the next decade. Now, those numbers are so big, it's hard to comprehend what the impact would be. It will mean $1,431 less care per year for each senior than if the law hadn't passed. Now, maybe that doesn't sound like so much, but the average senior only goes into the hospital once every 5 years. So in fact, the year you go into the hospital, it's going to be about $9,000 less care. Less care than if the law hadn't passed. How are the cuts made? Well, hospitals will be paid $247 billion less money than if this law hadn't passed. And that will have several impacts. Richard Foster, the chief actuary of Medicare, he works for the president, he testified to Congress twice that the cuts to hospitals are so severe that 15% of hospitals will stop accepting Medicare. Where will seniors go when their local hospital doesn't take Medicare? Here are how the cuts are made. Some of them are across-the-board cuts. And as a result, many hospitals are already laying off nurses. That's what hospitals do when they're paid less. They have to trim the staff. So they lay off the nurses, and the nurses who are still on the floor have a bigger workload. In addition, Section 3000A of the law awards bonus points to the hospitals that spend the least per senior. Think about that. Think about that. Section 3000A awards bonus points to the hospitals that spend the least per senior. I wouldn't take my beloved dog to the vet that spent the least per animal. Why would I take my mother to the hospital that spends the least per senior? We have copious evidence from the Archives of Internal Medicine that the hospitals that are in the bottom quintile on spending per senior have substantially higher death rates from common illnesses. For example, seniors in the hospital for heart attack are 12% less likely to survive. You don't have the same chance of making it out and going home again. So this law is incentivizing all the hospitals to imitate the hospitals that have the highest death rates. Do you think that's right? No. Of course not. And the way they calculate this is particularly troubling, because when they calculate spending per senior, they take into consideration not only what was spent on that senior in the hospital, but for 30 days afterward. So the hospital gets whacked for prescribing outpatient therapy after a hip replacement or a knee repair. Whacked if a patient with a heart attack goes back to see the cardiologist after being discharged from the hospital. That makes no sense. You need that aftercare. Seniors bear the brunt. Over half of the Obama health law is paid for by cuts to seniors. Think about that. Over half the entire law is paid for with cuts to seniors. Now, what are some of the best ways to cope with this law? Well, one thing to do is to have a serious talk with your doctor about keeping 2 sets of books. I mean it. And you know what? Doctors aren't going to laugh at you when you say that. They've taken the Hippocratic Oath and they take it seriously. But if we confide things to our doctors, we wouldn't want anybody else to know. And now is the time to say, you know, Doc, I'm going to talk about something with you, but I don't want it in that electronic database. Your doctor will understand completely. It's very serious, this issue of patient privacy. For 2 years now, advocates from all across the political spectrum, not just people on the right, but people on the left, the New York Civil Liberties Union, hammered away at Kathleen Sebelius, the Secretary of Health and Human Services, asking her to please provide privacy protections. So finally, a set of rules was issued in January. It was in the Federal Register. And you know what it said? If you want privacy, pay cash. That's not realistic. That's terrible. And now, more and more information is coming out about how many government agencies are going to have access to your information. Many, many agencies. The IRS, the Department of Health and Human Services, right? You laugh about the IRS.
It ain't funny.
Well, right, exactly. This is really a problem. Okay, here's another one. If you're a baby boomer, I wish I were still a baby boomer. If you're a baby boomer and you're going to turn 65 in 4 or 5 years, line up your doctors now, even if you're healthy. Line up a cardiologist, line up an internist. Because if you wait till you turn 65 and go on Medicare, you will not find a doctor willing to take you on as a patient. Doctors are going to be paid less under Medicare to treat seniors than any other kind of patient. So line up your health care now. If you know you're going into the hospital for elective surgery of some sort, like a knee repair, have enough money for a private duty nurse, at least for the first night. Because with all these layoffs, nurses are stretched so much thinner on the floor. When you push that button for pain control or help, you're going to wait a lot longer than in the past. And that doesn't just impact seniors. Anybody who's in the hospital is going to wait a lot longer for care when these layoffs take effect. What if you get your health insurance at work? That's where most people get it, 165 million people. Well, you're going to have some worries ahead. The estimates vary on how many people are going to lose their on-the-job coverage, but even the Obama administration admits at least 8 million. Their own projections show that fewer people will get health insurance on the job after the employer mandate goes into effect than before. What kind of a government would design a system with that result? Fewer people are going to have insurance on the job than before the employer mandate went into effect. The employer mandate says that employers with 50 or more full-time or full-time equivalent workers have to provide coverage. But not just any coverage, they have to provide this one-size-fits-all government-designed package that costs about twice as much as what many employers currently offer. So people running a business look at this and say, oh, I've always provided coverage, but I can't afford that, right? It adds on average $1.79 an hour to the cost of hiring somebody. Well, okay if you're hiring lawyers and accountants, but how about busboys and retail salespeople? You can't afford to add that much to the hourly cost, right? So the employers are saying, wait a second, I'm going to drop coverage, or I'm going to push my employees down to part-time status, so suddenly somebody who used to have a good job with on-the-job coverage now has a part-time job and no coverage. So the government estimates 8 million people will lose their insurance on the job. McKinsey and Company, management consultants, they estimate 30 million or more. We'll see in a very few weeks. But already, we're getting a lot of bad news from companies around the country that are throwing in the towel saying, we can't afford all the lawyers and accountants to deal with these regulations. Now, so those are a few pointers on how to protect yourself. If you think you're in that category, go talk to your employer now, or a manager in your office, or your human resources person, and get some heads up, because if you are going to lose your coverage, you are going to be going to the health insurance exchange. Now, you've heard the president say, that's like going to the mall. It's really like going to a supermarket that only sells cereal, right? There's only one thing sold at that exchange, the one-size-fits-all government-designed package. It's going to have 4 names: bronze, silver, gold, or platinum. Makes you think of the jewelry store. No. All the plans offer the same benefits, only the co-pays and the deductibles are different. So don't get bamboozled into springing for the platinum plan. It just means shelling out more money ahead of time and then having a lower copay and deductible later. It's only worth it if you have a lot of healthcare problems. Otherwise, you're wasting your money. Now, what is the likelihood that this law will be overturned? Well, there are many, many lawsuits in the courts right now, 61 involving just the contraception and abortion mandate. But many others as well. For example, Section 1311 that I mentioned at the beginning. That's clearly unconstitutional. The Supreme Court of the United States ruled in Gonzalez versus Oregon 5 years ago that the federal government could not attempt to standardize the practice of medicine and control how doctors in each state practice medicine. They ruled against it. So that case will eventually go to the Supreme Court. The challenges to mandatory contraception and abortion coverage, we have a very good chance of winning that. We're not taking freedoms away from anybody else, but don't force us to compromise our beliefs. This is a wonderful nation because we all have the freedom to believe what God tells us to believe, what our hearts tell us to believe. So for people who feel it's wrong to pay for that coverage, well, they should have that right. And this week, the United States Supreme Court ruled in a case that appears quite different from anything involving the Obama health law. The ruling actually improved our chances of winning on the contraception and mandate issue. It was actually a case involving prostitution. It was the case Agency for International Development versus Alliance for Open Society. The Supreme Court ruled that when the federal government makes grants to a private organization whose mission is to prevent AIDS, that the government can't force that private organization to take a stand against prostitution. Well, if the Supreme Court can protect the right to support prostitution, they should be able to protect the right to practice your religion, right? I mean, freedom is freedom. But our real challenge is in the our real opportunity is in the 2014 midterm elections, when we all go to the voting booth, all of us, to choose members of Congress and to elect 1/3 of the United States Senate. And that's where the action is going to be. We have a chance to make 2014 a referendum on the Obama health law. 2012 should have been, but voters got distracted. But now we can make it a referendum on the Obama health law because the weasels who wrote this law put all the lollipops up front. Keeping your children on your plan till they're 26, free preventive care. We know it's not free, right? We know it's not free. The cost is included in your premium. I often say that being forced to pay up front for a colonoscopy feels almost as bad as having to get one. That's what the Obama health law does. But now, the pain from this law is rolling out with a vengeance. People are losing their jobs, their on-the-job coverage, their full-time work status. They're losing their ability to keep their doctors and their health plans. California Exchange just announced that if you get one of those plans on the exchange, you're not going to be able to go to Cedars-Sinai or UCLA. No, you've got to drive by those academic hospitals and go to a cut-rate hospital that's willing to take a much lower payment, right? The exchange plans are not going to allow you to go to the fancy academic hospitals that most of us try to seek out, especially if we're seriously ill. Oh no. They're paying cut rates. It's like going to Costco, which is fine for paper towels, but not for a heart transplant. So, now the plan is rolling out with a vengeance. It's having an impact at work. It's having a huge impact on quality of care in a hospital. And of course, those of us who are seniors are really terrified, and we should be. But we can do something about it. We can go to the polls next year and pull the lever for candidates who are absolutely, firmly, unequivocally committed to getting rid of this law. The power is with us. And if we do that, we can get rid of it because there are 20 seats up for play that we can win. Let me explain it. 33 members of the United States Senate will be elected next year. 13 are already solidly Republican seats. Safe seats, they're called. And those people are going to vote to overturn this law. Then there are 20 other seats. And 12 of them, they're all held currently by Democrats. But 12 of them are in swing states or Republican-leaning states where we have a good chance of winning. We only have to win 6 out of those 12 to overturn this law. So let's do it. Let's protect our health care. Now, the stakes here are much higher than politics. Right now, if you're seriously ill, the best place to be is in the United States. We in this room have had the privilege of living through the golden age of medicine. A woman diagnosed with breast cancer in the United States has over a 90% chance of surviving it. In Europe, her chances are less than 80%. You do the arithmetic, that means she's twice as likely to die. A man diagnosed with prostate cancer in the United States, it's not a death sentence here. But in Europe, nearly 1 out of every 4 men diagnosed with prostate cancer dies from it. Yes. And if someone in your family has what's currently considered an incurable illness, this is the nation of hope. This is where the cures are developed. Since 1950, the United States has won more Nobel Prizes in medicine and physiology than the entire rest of the world combined. And that is why overturning this law is the fight of a lifetime, and we're going to do it. Please help me. So now I'd like to open up the floor to questions, because I hope I can answer all of them for you. Yes, ma'am. The iPad panel, is that what you're... The woman in the front here, I don't know your name, Karen, asked about the iPad panel. That stands for Independent Payment Advisory Board, a panel that's empowered starting in 2016 to make decisions about what Medicare will offer. Now, the weasel words in the law say they can't cut benefits, only payments. If you tell doctors that they're only going to get paid $10 to do a hip replacement, nobody's going to be able to get one anymore. And you know, Richard Foster, the chief actuary, warned Congress about that. He explained access to the kinds of procedures that seniors need will be drastically cut under this law. And that's what IPAP's real power is. IPAP has to keep down the spending, even though there are more seniors needing more treatments. And by the way, more medical knowledge to make life better as we age. There are 5 procedures that have virtually transformed the experience of aging in this country. Hip replacements, knee replacements, angioplasty, bypass surgery, and cataract surgery. Everyone we know relies on these miracle procedures. So common now, but still miracles nonetheless, to enhance our lives. When I was a kid, older people were stuck in nursing homes, right? Trapped in wheelchairs with crippling arthritis, or stuck in beds so out of breath they couldn't move. Now we're out enjoying our grandchildren and traveling and working until later in our lives. This law will undo that progress, and we can't let it happen. Our futures depend on this. So, you're right, we have to get rid of that iPad board, but we've got to get rid of the whole law.
Yeah. With the IRS having so many problems and the scandals and everything, is there a chance that the House might find a way not to fund them to get the 16,000 snoopers out there?
Yes, well, the House should use its powers of the purse to defund as much of this law as possible. It probably will come as no surprise to you that the agency heads, including Kathleen Sebelius at Health and Human Services, have been remarkably adept at moving money around within their agencies. So even if the House defunds the 16,000 IRS agents, the risk is that the IRS will find the money somewhere else to continue its task. But there are bills in the House now to take the fangs out of the IRS, to rule that the IRS can have no place in implementing this law. And I want to see how many Democrats have the guts to vote against that. Yes, sir, in the back.
First of all, thank you very much for being here. It's now a time struggling for doctors in recent years. My first question is, what areas, I mean, specialists not easy to find a doctor that's going to keep secretary books because, you know, knee replacements, things like that, they're making in the hospital. The other thing I'd like you to touch on...
Are you a physician, sir? You sound very knowledgeable.
No, but
about this. Why don't you come up here?
Unfortunately, I have a lot of time spent in the hospital.
I hope you're feeling better.
The other thing I'd like you to touch on is it's true that doctors are going to have to ask patients if they own a gun. And could you also touch on these navigators?
Okay, I'm going to touch on all of this. We'll start with the guns, because this was very alarming to me. I have to pay tribute to the NRA, although I'm not packing a gun, that the NRA, before this law was passed, understood what so many others did not understand. How intrusive this law could become. How the government's power over your health insurance could become a vehicle for finding out so many other things about you. And for those of you like this man in the back who've been in the hospital recently, you've probably noticed that when you check into the hospital now, they ask you all these questions that seem to have nothing to do with why you're in the hospital. And they keep telling you that they can't go on until you answer them, right? Well, one of those questions the NRA perceived would be, do you own a gun? So the NRA got a provision put into the law explicitly barring the Secretary of Health and Human Services from requiring doctors or hospitals to ask patients whether they have a gun. It's the only thing they can't ask you. It's the only thing they can't ask you. So the NRA was on top of that. But on January 16th, in the wake of that terrible event in Newtown, the President issued 23 executive directives, his proposals to eliminate gun violence. 3 of them had to do with eliminating medical privacy. So he's trying to get around that already. He called medical privacy, quote, an unnecessary legal barrier. Do you agree with that? No. We value our medical privacy. Now, on to the Navigators. Boy, is this a juicy tale. It saddens me to explain what is in this law because it's so cynical. No matter where you stand in politics, there's something good about looking out for the uninsured. Nobody should lose a home or a lifetime of savings because they got sick and didn't have health insurance. But the people who wrote this law cynically exploited a good cause for the basest partisan reasons. Throughout this bill, now a law, there are provisions that grant hundreds of millions of dollars at a clip to community organizations. Oh yeah, oh yeah. One section is community transformation grants. What do you think that's about? Well, I've been following these grants. Grants to organizations to do things like making videos so you get up and dance while you're at work. All kinds of, any pretext. All of these grants are going into inner city neighborhoods, and really it's being used to permanently fund highly partisan organizations that get out the vote. That's what it's about. So on to the Navigators. In the section of this law that deals with making the public aware of the health insurance exchanges and then helping people enroll in the health insurance exchanges, the authors of this law decided to outsource those jobs. Instead of having government employees do it, they would outsource those jobs to, you got it, community organizations. Why outsource? What does that accomplish? Well, community activists can say and do things government employees can't do. So let's take the example of California, which has already made its grants. The federal government took $910 million of our money and sent it to California for their health insurance exchange. And what did the Californians do? Number one, they passed a law saying that they could keep secret how they spent the money. Oh yeah. Number two, they passed a law that the health insurance exchange had to include voter registration. Oh yeah. Number three, they handed out grants to 48 organizations to do the outreach to the communities and prepare them for enrollment. Of the 48 organizations, only 8 had anything to do with health. The NAACP, the AFL-CIO, SEIU, all these big groups. And what were the grants made for? One-to-one education, door-to-door canvassing, robocalls, phone banks, all the things these organizations do to get out the vote. How dare they corrupt this project, this ostensible effort to help the uninsured, into just a mere tool to tilt the scales against a fair two-party system and give us a one-party banana republic. It's an outrage. It's an outrage.
I doubt that a lot of people in this room have heard of Ezekiel Emanuel and how basically this law is the codification of his vision.
Yes.
If you could touch on that.
Yes. Ezekiel Emanuel, Dr. Death, I call him. Ezekiel Emanuel had a very heavy hand in the early planning of the Obama health law, along with Donald Berwick and a couple of others. Ezekiel Emanuel, whose brother was chief of staff of the president at one point. But what was worrisome about Ezekiel Emanuel was not his familial connections or his political clout. It was his writings. When I went to look at what he had written over the years, this is a man who does not respect life. He actually, and by the way, there's an irony because he calls himself a medical ethicist. Yeah, this is a new profession for people who want to invent a new code of ethics because they don't agree with what the rest of us feel. Right? He calls himself a medical ethicist. So he argues that Americans expect too much from health care. They ought to be able to get used to the lower standard of care, the fewer amenities, the long waits that Europeans endure. I don't think so. He also, and you're probably thinking of this, I call it the Grim Reaper curve. He actually drew a curve of who should get to live and who should die if medical assets were scarce. Not only did he put us old folks way at this end, we didn't have much chance of surviving, but he also put infants and small children in the same category. He didn't think they had enough personality yet, enough character yet to deserve to live. Does anybody in this room agree with such a proposition that a man like that can decide who lives and who dies? Absolutely not.
Society hasn't.
Good riddance to him. Yes, yes, ma'am.
Yes, hi. I am a medical provider as well as a victim, and I happen to work in mental health. So the chips are a little higher there as far as confidentiality is concerned.
Yes, very high.
Due to the SAFE Act, I'm supposed to mark on my clients and report them to the state and so on and so forth if they're in danger of self-harm. What I'm starting to hear about is, at least in New York, we have these regional councils now. And I'm hearing that we are being tasked, these regional councils are being tasked now to send caseworkers out, knock on the doors of people who have two or more diagnoses out of a list of diagnoses, heart problems, diabetes, there's the heavy hitters. And that ostensibly the effort is to keep them out of the hospitals. But it's so invasive. You're going to have somebody knocking on your door, making sure, did you do this? Are you eating right? What's your BMI? Get on the scale. You're diabetic. You're too fat. This is insanity.
Here is the problem. When government takes control of your health care, you have no freedom or privacy left. And that is exactly what's happening. You know, I have a daughter who lives in England. And she's given me 2 gorgeous grandbabies. And I was astounded. Of course I went over for the births, and I was astounded 5 weeks or so after the second baby came home from the hospital, little Diana, who's turning 1 next week. A government official knocks at the door. They go and visit every single household periodically to see whether mom's taking care of the baby. I couldn't believe it, in that kind of invasiveness. My daughter and her husband have no history of child abuse or neglect. Why would the government be peering over their shoulders? Don't you think that's a little too much? Yes, so I didn't mean to interrupt you, but yes, that's very invasive. If someone wants that kind of help, they should reach out for
The
it.
regional councils are starting to take over all of the agencies. Like the Long Island region is now under this health home from like the Hudson Valley that's overseeing all of the mental health and social and substance abuse agencies on all of Long Island. And they're reporting to some...
Right, and people are going to be very reluctant to seek out mental health help. If they think it's going to be reported, you won't get a driver's license, you won't get a job, you won't be able to do this or that or the other thing because you sought out help when you were having problems. And who doesn't have a problem of some nature at some point in their life?
But I don't have a problem keeping that second set of books.
Thank you.
Okay?
I don't have a problem keeping that second set of books.
I'm going to hold this up for you. Go ahead.
I've heard quite another story of doctors asking, they've sent up a plan now with upfront $5,000 because they don't want to get into the Obamacare thing. And I guess as you pay the visit, you chew up that $5,000. My brother's one of them. And I was just wondering if
He's
she's
the chewer or the chewy?
He's the chewy. Yeah. Anyway, that's what I'm hearing. I didn't know, you know.
We're going to be paying with
Yes.
chickens.
Well, this actually preceded Obamacare, but there's more and more of it now. Before Obamacare, many of you may have heard about concierge medicine. People who paid a fee so they could have instant and repeated and very fast access to the doctors. Why not? You should be able to buy whatever you want. Now, of course, with so many doctors saying they want to leave insurance or particularly leave Medicare, you're going to hear about more and more doctors saying, I don't want to give up the practice of medicine, but I'm not going to be able to deal with this. So they will be taking cash. Yes, ma'am, I promised before. I'm sorry I left you in.
In line with Dr. Deerwick and Dr. Emanuel, given that philosophy, isn't it not possible the medical ethicists who are on those medical boards in those hospitals opening up the door to assisted suicide and euthanasia in the hospital, particularly to those elderly who are on their own?
Okay, this is a very important question. Very, very important. And I see this trend already in hospitals.
Betsy, people are having trouble hearing the question.
Okay,
Could you
I'm
repeat?
going to repeat it the best I can. The questioner raised the issue of hastening death at the end of life. And what's going to happen in the hospitals and whether these ethicists are pushing us in that direction, and clearly they are. I respect anyone's right to go to hospice or to have a talk with their doctor about how they want to end their life at the end. But I don't want somebody else making those decisions. And the fact is there are already too many pressures in some hospitals. Let him go. His life isn't going to have that quality anymore. You know, you don't want him on a feeding tube. Well, there shouldn't be those kinds of pressures. Life is so precious, and the only people who should define quality of life and when it's worth living is the patient and the patient's closest loved ones, not hospital administrators. Their goal, their duty, their oath is to protect life.
Just in answer to that also,
Yes.
in New York State, there's a law that doctors and nurses must discuss palliative care options for dying or very sick patients.
Yeah, it's a very bad law.
And
It's a very bad
I
law.
personally received an email on election day of all days, ironically, telling me, because I'm a clinical social worker, what my role is in helping people adjust to the idea of dying instead of getting health care.
Yes, it's a very bad law. Let me explain this. And it's terrible that it passed in New York. I fought very hard against it, and we did defeat it in Massachusetts. There was a law in New York. You can thank your state lawmakers for this. I hope you throw them out. We have the worst legislature in the country. They passed a law in New York requiring that physicians and nurses have a talk with anyone who is seriously ill, right, about dying. Well, some families don't want that talk, and some people don't want that talk. We all know it's available, but you shouldn't have to sit down and talk about that. I'll give you a very personal insight. My true love is 83. He's brilliant, he's handsome, I love him with all my heart. And he was in the hospital for 3 months last year. I spent every night there. I didn't dare leave. At one point he was in the ICU on a ventilator, and a nurse came in and said, "Let him go. Let him go. It's not going to be worth it. First he'll have the ventilator, then he'll have the feeding tube." He does have a feeding tube, but he still puts on his suit and goes out to dinner with me, right? So I said to her, "Don't you ever come in this room again. Don't you ever." So he recovered. He only had pneumonia. He recovered. And we're about to be discharged from the hospital, and I wanted him to go to Burke, which is a fabulous rehab place in Westchester, where he could regain his strength. When you've been in the hospital 3 months at that age, you can't walk anymore. And they said, no, he'll never be himself again. Just put him in a nursing home. Finally, I said, if you don't recommend that he gets to Burke, I'm going to sue you. So he got there. And the third thing I did, and I would recommend this if you ever encountered this experience, when they were all naysayers in the hospital, I had a beautiful portrait of him at home. Big. A little bigger than all of this. A portrait of him in his 3-piece suit. And I took it off the wall, and I brought it down to the hospital, and I hung it up next to his bed. And whenever a doctor or nurse came in, I said, "That's the person you're treating, and he's going to look like that again someday." And he does. It's always worth the fight. It's always worth it. Yes, sir.
Has the IRS audited you yet?
No comments. Yes, sir.
If I go to a hospital and hire a private duty nurse, don't you think that the federal government would put a conflict in the way between that private duty nurse doing the job at that hospital?
No. No, you can still go to call nursing agencies, hire private duty nurses, and pay for them yourself. And it's well worth it. Yes, sir.
Right.
You spoke very eloquently in the interests of seniors and of the middle class. But we should not forget that 30% of Americans are either poor or near poor. So, after you have abolished Obamacare, what do you propose to do for those 35 millions?
I am so glad you asked, because I have a plan, it's already written into a bill, and I want to help them. As I said before, no one should go without health care because they're poor and they couldn't afford insurance. So let me explain the answer.
3 lines, what that plan would be.
Yes.
If it includes insurance, and if not, why not?
Okay, I'm going to tell you, because it does include insurance. First of all, let me point out that the truly poor are eligible for Medicaid, unless they're in the country illegally. We have social insurance for the truly poor. There are people in that income category above Medicaid who are suffering, and we should be able to help them with insurance. And here is my 4-point plan, which is in bill form, and you can get it on my website, BetsyMcCaughey.com. Number 1, it helps people pay for COBRA if they lose their job. Industrious people who have had health insurance on the job and then suddenly find themselves confronting these huge COBRA payments, that's the time to help them. They'll be on the job again soon, and that help will not be needed permanently. Number 2, allow people to buy health insurance across state lines. New Yorkers pay among the highest rates in the country. Why should a young man in his 20s or 30s in New York have to pay 4 times what a young man in California pays? That's why he's uninsured. He'd be a dope to pay New York rates. But if he could go online and buy insurance from a California carrier, he would be insured. Number 3, tort reform. Too much of this money is going to the trial lawyers. And number 4, instead of dictating what kind of insurance people have, taking all the choice away from them, assuming that they're too stupid to buy the health care they need, what we should do is the same thing we did for families who need help putting food on the table. We could load a debit card with enough buying power based on the size of their family and their income so that they could go out and buy their own insurance, right? Respect people's intelligence. Washington doesn't know best. Are that when the Obama health law is all rolled out, we're still going to have 30 million uninsured. So what was all this about? One more question. Yes, ma'am, at the back with a pretty pink shirt. Go ahead.
I have a adult child with Down syndrome who's had many years of horrible medical problems. What is this law going to do to her in the future for her care and for friends like?
Well, that's a very big concern of mine, and it's not spelled out in the Obama health law. But the bias.
What was the question?
In that, this lady has a child with Down syndrome, an adult child now. But she's obviously very concerned about this child's future. The biases in this law are against specialty care, against people with chronic disease, against people with lifetime needs. And that's my worry. It's the Ezekiel Emanuel syndrome. And socialized medicine is great until you get sick. But I'd like to talk to you privately about things we can do to help protect you, or protect your child afterwards.
Dr. McCaughey, any comments on the union's
Oh yes, this is really a big issue. In the Obama health law is something called the Cadillac tax. It's a tax imposed on the most generous health plans. The idea that the government punishes you if you don't have health insurance, but also punishes you if you have what they consider too much health insurance, right? As if it's their business. So, the Cadillac tax is actually going to fall more on union plans than any other plans, because unions over the years have bargained themselves some very nice health coverage. The reason the Cadillac tax didn't go into effect immediately is that they never would have gotten the bill through Congress with the Cadillac tax, so they pushed it to 2018. They didn't want to take it out of the bill because the Cadillac tax is credited with $111 billion of revenue. It's what they use to say this bill is paid for, right? It's never going to go into effect. I guarantee you those Democrats in Congress are going to repeal the Cadillac tax or they won't get elected again. Do you think I should keep going? Maybe. I know some people want to go home. I'm happy to answer questions all night. I'll just sit at a table and do it. One more. This lady in the pretty sweater.
Okay. My sister lives in Florida, and she sent me this here thing. It's about a hidden tax that's an excise tax, and it's from Cabela's, which is a fishing store.
This is untrue.
It's true?
It's untrue.
It's untrue?
Yeah, I've looked into it several times.
Oh,
it's untrue. But I want to thank you all. I will answer your questions.
I want you to answer this.
Okay, go ahead.
We know the impact it's going to have on them. And it's going to affect young people's families. Can you tell us so we can go back and tell our children how it's going to affect them?
you go out and buy your own health plan or get it at work. Well, there are three big pressures on the insurers to push the rates way up. That's why they're up 51% in California, 88% in Ohio. Those are the earliest exchanges, but we'll get more figures soon. To keep them from spiking even more, insurers have substantially reduced access to doctors and hospitals. I mentioned this before. So in answer to your question, one thing you'll find is you may not be able to stay with the doctor and hospital you've chosen in the past or would like to use because your plan won't cover them anymore. That's one big difference. The second big difference is that Kathleen Sebelius and the Department of Health and Human Services is going to be pressuring the insurance companies to reduce healthcare consumption even by people who are insurance plans they pay for themselves. So your doctor, there's going to be a lot of pressure on doctors. Don't order that MRI, not so many mammograms, please, that sort of thing. You're going to see a lot of pressure to reduce the level of care. And you're going to see higher premiums.
For young people?
Yes. For young people. Yes, for everyone. Now, I'm going to answer lots more questions, but I know some people in this room are tired of hearing me, so I will sit at the table and answer every question. Just come on up and ask.